Hi everyone, welcome to Camille's Holistic Health Show. I'm Dr. Camille McClellan, and I'm going to talk to you today about managing and coping your anxiety. And when we talk about anxiety, so many people suffer with this, and there are different types of anxiety. I'm going to go into it in detail later on, but today, seeing that it's such a fast-paced world that we live in, anxiety is something that everyone has to manage and cope with in some way, in some aspect of their lives. And how you cope with it, how you manage it, makes a world of difference. So we're going to go into it. We're going to talk about the different types of anxiety that conventional medicine providers diagnose you with, how you can manage it, and how you can cope with it. So again, if you can just subscribe to my YouTube channel, hit that bell so every time a new video comes out, you'll be able to listen to it right away. So let's get into the various different types of anxiety and how you can manage and cope with it. So specific types of techniques can help, manage your cope with your anxiety. And there are different types of triggers, as you know, that can actually cause your anxiety. Different types of, uh, types of stress that can really trigger it and cause a rippling effect, and then you go into a spiraling of you know different symptoms in your anxiety. And how you deal with it is the most important way of how you can get out of your anxiety. So it's very interesting to know that many people think that their anxiety is either provoked by a problem or probably by a dangerous situation, and or by a past situation that still comes up in their life. So let's take a look at generalized anxiety disorders. This is what many psychiatrists and psychologists and conventional doctors out there usually diagnose you or someone else with, and usually that person is experiencing prolonged types of anxiety. And then it could be all types. It could be from anywhere of just worrying about their future, about their past, about their present times in their lives, financial, whatever, to the news and broadcasting and fears of walking outside of their home and getting hurt, or someone breaking into their home. So this is just a generalized anxiety. It always comes up. It's always there, and it's usually a type of anxiety that lasts about 6 months, and often it affects women. So generally, generalized anxiety affects women. And then we have specific phobias. This is definitely something where people are focused on an intense situation in their lives. It's commonly due to a fear of heights or enclosed spaces, and just any type of color or a snake or some type of animal. And they are generally provoked or triggered by some type of fear that they had in their past, or something that triggered them in their present lives. So this is another type of anxiety disorder that someone may present with certain symptoms. And certain symptoms include shortness of breath, palpitations, nausea, just tremors, okay? And that's specific phobia. Now we have also panic attacks, and this comes about either by a trigger of a fear or an injury that you've had, and then it comes about because of the situation you're in. You've never been in this situation before, and then it can trigger it time and time again in different situations thereafter. And lots of times these panic attacks can have symptoms of chest pain, shortness of breath, dizziness, and fear of losing control. That's pretty much an important symptom in panic disorder. And they're often reluctant to be alone. And there are lots of ways to cope with panic attacks. Lots of people have gone into dealing it with medication, but there's also other ways to deal with this as well. And then they have social phobia, where people are afraid of getting into different places, public places, parties, in a little small group, in a restaurant. They'll start to have a lot of fear. And again, those are the triggers of social anxiety. And then we have obsessive compulsive disorder, and this is often due to compulsion of a certain idea or a certain constant behavior you want to keep clean, in that you want to avoid being not having bacteria on your tables or your counters, and you're constantly cleaning. So it's just an obsession, an over obsession of a certain area in your home or a certain area in your car, just an over abundance of anxiety when it comes to your space, when it comes to your confinement. And post-traumatic stress is often, it's an anxiety that comes up a lot. It could come up with not only people that go to war. It can come up with anybody living a daily life who has had an injury, who's had some kind of trauma in their past when they were younger, or a trauma when they were married to someone. It could be related to an object, it could be related to a person or a situation. And it manifests by re-experiencing an event, by crying uncontrollably, panicking, losing control. So oftentimes it can manifest in dreams as well. So those are the types of anxiety disorders: the generalized anxiety, the specific phobia, the panic attacks, the social phobia, the obsessive compulsive, and the post-traumatic stress disorders. So when we talk about coping and managing the different anxiety disorders that are out there, it's very important to take the time to choose the right type of techniques that will work for you, that will work for your anxieties. And when we first look at a natural modality or a different type of technique that can help with your anxiety, it's about relaxation. Relaxation techniques is always a very, very good technique to go back to. It's a person feeling anxious most of the time has trouble relaxing. However, learning how to release muscle tension is an important uh, anxiety relief technique. And going back to meditating and relaxing those muscles, relaxing those abdominal muscles that tense up and causes you not to breathe deeply, is the first way to then go into mindfulness or mindfulness techniques, telling yourself what's going on, what's triggering it, why is it occurring, and then focusing on the different things to help you release a lot of the tension. Now, it's releasing and then letting go of the areas where the tension or the energy builds up. Oftentimes it builds up in the throat. It might build up in the stomach. It might build up, in the lower abdominal area. It might start tensing up in your limbs, your lower limbs or your upper limbs, or your neck, or the back of your neck as well. These are areas of your body to first recognize, especially the abdominal area where the phrenic nerve is, and you are tensing up the area where the lungs are needing to expand and contract. Okay, so that is the main part of mindfulness. And then you bring down your respiration, and your heart rate and your breathing. That's the most important part, is to bring down the way that you're breathing. Okay, so like I mentioned, the breathing techniques is important to prevent hyperventilation and rapid breathing. Okay, and this will because this will raise your oxygen levels and reduce the carbon dioxide. Okay, when you hyperventilate, but you want the reverse. You want to breathe and allow your diaphragm to go relax in and out. All right, and this technique can actually improve your overall anxiety once it starts. And a lot of conventional doctors talk about cognitive therapy, and that is something that they can handle and they can talk to you about. And those are triggers. The basis of cognitive therapy is that the idea of triggering thoughts, which then trigger feelings, results in manifesting through actions. So cognitive therapy strategies should include, rational talking, rational self-talk, training on attention, and reality testing to cognitive challenging and cognitive restructuring. Now, those are things that you will go into more detail with your therapist. This means, you basically are monitoring your self-talk. You're changing or challenging those fears that come up and those beliefs and thoughts that are coming up, and checking out the negative thought process related to this as well. Okay, and then we go into medications, and there are lots of medications out there, and then there are also lots of conventional medicines, and there are lots of other natural medicines, depending on what you want, pretty much you're here because you want something more natural, your practitioner will give you or guide you to the right types of herbals, homeopathics, and supplements that are geared for you individually. And then we talk about dietary foods. As we know, nicotine and caffeine are definitely one of the triggers. So if this is something that is more geared to your triggers, then you want to consider reducing your nicotine and or your caffeine, and trying to go more natural. Then we have top foods or top superfoods that actually can benefit anxiety, and this includes dark chocolate, Brazil nuts, eggs, pumpkin seeds, and chamomile tea is definitely a very light, very palatable tea to ingest. And avocados, kale, salmon, turkey, okay, those are some great anxiety dietary nutritional foods. Then we talk about exercise. Everybody is so into running out there and exercising, but it's also very based and individualized on you, right? For me, too much intense workout can actually not help me reduce my stress. And other people are like that too. While there are people who need to get on a very rigid, regimental type of very active type of exercise in order to reduce their stress. So it's based on you, and however you feel fit, then you must incorporate exercise with anxiety. And again, this is mindfulness we're talking about, is being aware of when your triggers start and when you should start doing it, movement a little more, relaxing, forgetting about the things that are a little stressful. I know that's very difficult. I totally understand. And life gets in the way of everything. I totally understand that. But it's also important to know your triggers, know where you're holding that tension in, and how to then mindfully take those techniques, use them, and apply them. Okay. One of the great exercises is yoga. Now this, because it reduces a lot of the racing mind. I'm not talking about racing mind in a way where it's affecting your mind. What I mean that you're just thinking about the different things that you need to do in your life, in your daily day, your tasks, all the things that you need to do that then triggers a little anxiety. That's what I'm talking about. This will help you slow down with the way you're thinking. So you do less tension, less holding of your muscles in your body, and your brows tensing in there, and then you stop breathing. You stop breathing correctly. Okay? So it's important to know that 3 to 4 times a week you should be doing a little movement, especially if you suffer with anxiety a lot more than the regular person. And you want to use things like yoga. You want to implement exercises like yoga, brisk walking, walking in nature, to slow down the pace of how you are processing things in your daily life. Okay? Dancing, things to take you away from your situations, temporarily take you away. And that's the key to improving your overall health when it comes to your anxiety, when it comes to dealing with it, coping with it, managing it. Okay? Gardening is another one. And Tai Chi, slowing the pace of how things are going in your life. You want to do that. Okay? So these are great techniques. I talked about the different types of anxiety and the different dietary, nutritional foods, the top ones, that you can incorporate everything to then, get into a routine to manage and cope with your anxiety. I hope that this video has helped you in any way. Please, if you have any comments, please put them below and I will get to them as soon as I can. Thank you so much, and I'll see you in the next video. Bye now.